Hi there, it's Dr. Scott MacLean. In this video, we'll be talking about the flat pontic in the lower anterior bridge. And usually I'm putting 2 implants in down here. You can see as we take these teeth out digitally, we've erased these using Mishmexer. And we're looking at the digital model, which is an intraoral scan. And what I'm going to do is kind of plan the implants out. This is my first patient after COVID, and you can see my new outfit. And anyway, it's a whole new world. But we're going to be showing you how we do a setup. So we do a smart setup on the model so we can determine where we want to place the implants. Now the 2 anterior pontics, in the past I used to make them shaped like this, but now I'm starting to make these flat, almost like an all-on-4, so that they can clean this, because the patient really doesn't have an issue with kind of aesthetics down here. The lip is never really pulled down so that they're being shown. So I'm going to more towards a flat area. Now we're going to use guided surgery. You can see the purple kind of STL file that we're generating, and this will be used to place the implants in the positions. So in this position and also on the other side. So you can see how much bone loss there is around here, but we have to be respectful to the bone of the canine. We don't want to take the bone back too much because we do have to protect the bone of the canine even though we're putting implants in here. So we have to choose a depth that's going to be appropriate for the bone level, also for the soft tissue level, and looking at the whole system. And so we place the implants and we kind of lean them up against the lingual plate, and so this will determine the kind of angulation of the implants. And you'll notice as the lab tech is generating, my final prosthesis, not my final prosthesis, but my transitional prosthesis, that the prosthesis should have been maybe a little bit wider. So here's the rings that generate the position of the implant when I make my template. And so you can see that I'm putting in 3.75 by 13 millimeter NOBELPARALLEL implants. And so they have to be a little bit lingual here because of the bone. And this is due to the lingual plate. And this is kind of dictating the way that these implants will be, unless you're going to graft, which I wouldn't do in this type of case. But as we look at this case, you can see that we want to have this coming through the lingual aspect of the 2 laterals. And so ideally the wax up even would be a little bit more to the lingual when we're doing this, but you can generate this when we're using kind of the resin, as I'll show you in a second. We can use that resin to kind of go inside and make this into a better position for you to use. So you see that the teeth are not really held in any bone, so we're going to have to cut that back, but we want to flatten the 2 center pontics down a little bit and not make them into like tooth forms. Patients have too much of a hard time cleaning this. So we've got our template generated. We've printed this in our office. You can see it's ready to go. And we have our TEMPSHELL, which is made by milling. And so one is printed and one is milled. So you can see that it's actually a bit too thin on those laterals. So they could have built that out a little bit bigger. It will save me a little bit more time when I'm doing surgery. But we'll take the teeth out, extract those. They come out pretty easy. And this patient is cooperating quite well, and we have the ability to try the temps in now. So we'll put those, lay the wings on the adjacent teeth, and we'll just see how they look and see what the positioning of the kind of tooth position is, because really we can see it before we even start. So the extractions went uneventful, and the patient is just moderately sedated here. She's, doing okay. This is not a big procedure for her. So when we're going through this, we can see that our goal is to get this kind of cleaned up. So we'll go in, curette those areas, go back and place the implants. Unfortunately, we don't have video of that, but we show you we're going to level the bone a little bit here to make that flat pontic, and we'll add a little bit of bone grafting in that area too. So we just took a small round burr and kind of leveled down that middle bone a little bit to make it flat. So this will make it cleansable. Here's the implant. It's an anodized implant, and you can see that it has this gold kind of anodization that happens. And so when we place this implant in, we get a kind of better muco integration with the implant supposedly. So soft tissue is, and also the bone are exhibiting less inflammation according to some of the literature coming out. We can see we place the implants in position. The drilling, we unfortunately didn't get that videotaped due to COVID. You know, we're still getting back to our feet. Anyway, so once we take the guides off, the implants have been positioned based on that surgical plan, and then we're able to come back and start to build our temporary bridge, which is what this video is more about. And by doing so, the patient actually can have the transitional the same day that they're in for the implants. So she has a bit of an anterior open bite, which is going to help us here. And so we just have a look at the implants, and we'll put maybe a little bit of bone grafting in there. But our goal is to fabricate the transitional bridge using the TEMPSHELL. And the TEMPSHELL is going to be fit around these implants. So these are exactly where we want the implants to be. And we put the TEMPSHELL cylinders on. So these are titanium cylinders. And then we pick it up with resin. So we're using flowable resin, and we're using Luxaflow. And so then I'll make this area flat in between the two implants for soft tissue to kind of grow at the time of we're not really waiting for the tissues to make their move. We're kind of creating the tissues to be flat so that the floss will pull across there very easily, but we'll still have a nice seal with the soft tissue.
Move forward, back.
So I like this kind of concept, and it makes it so that the patient doesn't have any occlusion on the bridge, so we don't want that during healing. So anyway, try this out. It's Dr. Scott MacLean. This has been a YouTube video about implant dentistry.